Probably high school. My older brother was just starting medical school, so that's how I got exposed to it. Well, for a year before I went to medical school, I worked in the ENT clinic at the hospital at Chapel Hill. But I had an open mind going into medical school, and it sort of came down to neurosurgery or ENT. And ENT appealed to me because you got to see people of all ages, and men and women, and at all stages of life. And most of them were reasonably healthy, and not too many of them did poorly. So it was a good specialty. With children, surgically, it's ear tubes, tonsils is most of it. But we see with the neonatal intensive care unit here and the pediatric specialty clinic at the hospital, we see a variety of problems. I'm part of the cleft palate team because most of those children have ear problems. And then in adults, it's chronic sinus disease. We see, unfortunately, a fair amount of head and neck cancer. I do a lot of thyroid and parathyroid surgery. In our office, we do allergy testing and full battery of allergy therapy. And then recently I've started doing thyroid ultrasound and needle biopsies in the office. So we're sort of an expanding specialty, which makes it fun. I enjoy their stories. I always ask adults, what kind of work do you do? How does this impact your life, the problem they've come in for? And I hear some incredible stories of people in this area because there's a lot of retirement population. They're from all over the world. They've done very interesting things. And so I think that's the part I enjoy the most. Now, technically, I love doing surgery. It's what makes me tick, but it's not all surgery. And one of the hardest things about surgery is not doing it. It's deciding who needs it and who doesn't. Well, I've got 5 children, so that's sort of the whole answer right there. But I enjoy, I occasionally play golf. Don't play enough. But mainly it relates to my family and spending time with them, because with this job, I'm away from them more than I'd like to be.